the world, the media is getting saturated with a lot of hoax news stories, false claims, exaggerated headlines. Simply, fake news is spreading fast.
In this pandemic, fake news is a new infodemic. But fearless journalists at JoyNews are on the front line fighting fake news with a series of fact-checked, compelling news reports. The JoyNews Combat Fake News Project, clearing the blurry lines between fake news and the news.
Welcome back to the Pulse. The World Health Organization has urged people to cancel some of their holiday plans to protect public health as the Omicron variant spreads globally. An event cancelled is better than a life cancelled. That's according to WHO head Dr. Tedros Adhanom Ghebreyesus, adding that difficult decisions must be made. A number of countries have acted to try to halt the spread of the variant, including imposing travel bans. In the US, Omicron is now dominant, accounting for 73% of new infections. In Ghana, 3 countries have been banned from coming into the country, or the country members traveling to that country after their recording of the variant. There have been stricter measures by the Ghana Health Service, including compulsory vaccination, which is now being challenged legally. We'll be getting more on the suit against the compulsory vaccination. But first, let's speak with Dr. Michael Owusu, who is a virologist at the KCCR and lecturer at KNUST. Doc, I'm grateful for your time. We are told that cases are rising, and with the festive season in sight, WHO is warning there could be a 4th wave, which could be dangerous. What is the situation right now as we speak?
Yeah, good afternoon to you, and good afternoon to all your listeners. So the situation, as you have mentioned, is the fact that cases are rising, and the cases coming through the airport seem to be having some sort of negative impact on the cases which are also in the community. So initially, we heard the Ghana Health Service mention that the cases at the airports are on the increase. But as we speak now, it looks as if the community cases are also picking up. And mainly because, the protocols have been relaxed. People are not just adhering. So for the few cases that entered through the country to the airport, I think that this has succeeded in permeating through the communities. And we are not talking about imported cases, but we are now worried more about the community cases which are on the rise. And if things continue as they are, this will likely take us to the 4th wave somewhere, possibly in January, where the cases will mainly hit, will rise very high, as we saw in the previous year.
What does this mean? With the latest information that the Omicron spread has taken over at the community level?
Yeah, the Omicron is highly transmissible. It's almost about 60 to 80% more transmissible than the Delta. And if you have studied the viruses, anytime mutations occur, the ones that mutate are much stronger and are able to infect more compared to the previous one. So, Delta was very strong, was able to infect many people, but Omicron is almost much higher, 80% much higher strength than Delta. So what it means is that this is likely to spread very quickly, infect many more people. But one thing we have seemed to realize about Omicron from lab data seem to show that unlike Delta, which is able to infect the lung cells and able to cause a severe disease and possible death, the Omicron is able to infect all right, but it doesn't seem to have the ability to permeate through the lung cells. So it looks as if many people seem to experience moderate illness, few severe cases, but death looks highly improbable. So this is the kind of advantage the Omicron has. But some way, somehow, I mean, whether it causes death or severe disease or not, the point is that you are likely to have mild illness, likely to cough, likely to have fever. So within this time, so possibly January and February, there are likely to be more people who will be reporting of flu-like symptoms, and this is likely to suggest that these people might have been infected, and is likely to be Omicron because of the high transmissibility. Also, couple the fact that we are in the Harmattan season, and this season is more conducive for transmission of respiratory viruses. So, I mean, the weather, the dryness, and all this is likely to contribute to increase in cases, which is why we are hoping that people will adhere to the protocol. But it's unfortunate that we seem to be enjoying the Christmas and are in the mood to celebrate more. So my fear is that this may lead to, overall increase in large cases, maybe after the Christmas. But if we don't do anything.
That you talk about Christmas, because the WHO is urging countries not to celebrate Christmas. And I'm asking, are we at that point, we here in Ghana, that we can put all planned Christmas activities on hold? Have we reached that stage?
Of course. Once we have started recording community cases, it's irreversible. We can't reverse the community cases. It's going to increase and it's going to hit the peak until the virus gets satisfied before declining again. So once it begins to rise, the best thing is to try to put in measures to slow the spread and to slow the rate of transmission. So some of this could be trying to ensure that activities where large people gather, as much as you can, you prevent this, or you lessen or you put some level of restrictions on this. If all these activities go through like that, then of course, this is going to increase in hundreds of folds, and you're likely to have large cases. So ideally, if we are able to do that, it will help to slow down the spread. But if not, if we are not able to do that, then of course, we should be prepared for a massive fourth wave, which has already started some way, somehow.
But with the compulsory vaccination and the mandatory restriction measures at the airport, for instance, and elsewhere, shouldn't we be okay to go about our normal duties?
Well, you know that this Omicron virus has some leverage in terms of, penetrating even for those who have fully vaccinated. It has that ability because of the mutation that it has. So, once you are vaccinated, you can be infected. But the point is that you may not have severe disease, but you can also transmit. You are also aware that vaccination will have been helpful. If we're able to ramp this up and cover large populations, we can reduce the number of people who have severe disease and possible death. But with the vaccine hesitancy in the system, it seems to be slowing the vaccination rate. And this is a source of worry to many of us, that a vaccination could help us at least reduce the number of severe cases, and people are already fighting off and are hesitant and are not willing to embrace this. Then the effort we are making in cutting down on the severe cases may be difficult. We may have some difficulty in achieving our target. Talking about the airport, the restrictions are good. The testing is good. But you know that if 100 people test positive at the airport, you are likely to have 1 or 2 people escape through the airports. If these people escape into the community and already we are on mask and are willing to embrace and interact with them, it's only a matter of time, and this will just rise and infect everybody. So in as much as we are putting in these measures at the airport, those of us in the community must help to limit and reduce the spread. But if we are also jubilating and interacting and doing what we are doing, then of course we are only waiting for this time bomb, which is already here with us. So it's a combination of all these factors that helps to reduce cases. You can't just use one tool to limit and reduce spread. It's a multiple events put together is what results in reduction of cases. But if we are just watching one area without looking at the other areas, then of course we will be putting in effort, but this will not yield much. And the fear is that this may lead us to a potential danger with this fourth wave.
It's obvious that we cannot meet our deadline or our target of vaccinating 20 million people. In fact, the last time we spoke with the Ghana Health Service, it indicated we had only vaccinated a little over 7 million people. Now, you have also mentioned the vaccine hesitancy. a challenge that we've been battling with even before we introduced the mandatory vaccination and the compulsory vaccination. What's the reality with what you know? I mean, with regards to our target, is it something that we can meet?
Of course, I mean, for this year, it doesn't look like we can meet the target. Simply, next year may be more suitable for us. I mean, people initially were excited about the vaccine, were all out going to take it, but then with the hesitancy in the system, it's going to slow this process. So there's a need for more engagement, a need for people to understand and embrace this, and this will take some time. I'm hoping that next year, possibly first quarter of next year, we should be able to cover some more people and to get more people vaccinated. But my fear is that some of the vaccines are likely to expire. This is the challenge. So people don't embrace this and people don't accept and get this run through the system. It will be very unfortunate for government to invest in this huge number of vaccines, and due to our own behavior and hesitancy and all the comments going around, we leave this to expire. I'm not too sure the motivation government will have in getting some additional vaccines when the ones we have are not working. So are not going to be used. So I think we all need to work, encourage people, let people understand that these are safe vaccines. I mean, we've all taken it and we are fine. So if we don't embrace this, then we may live to see some of these vaccines in the system not being used. And this is a cost to all of us. And this may not enable us to achieve our expected herd immunity, which is what we are expecting.
It's definitely worrying as we are told about the spread of the Omicron in our communities. And you have also spoken about the Harmattan season, which will aid a more transmission of these variants, and the fact that we are heading towards danger, a possible fourth wave if we do not check what is going on. Right now, it is obvious that government is struggling to implement its measures, even though it's achieved some extent of success. But right now, what should be happening with at the government level, at the individual level, especially because we have the festivities ahead of us?
Well, you know, in Ghana, one thing that works is when the leaders begin to take active part in the campaign. And the leaders not just being government, but religious leaders, community leaders, chiefs, market women, transport unions. We should be able to bring all these people together, have ambassadors, even including the media, to advocate for good vaccine administration, to support this campaign, but then to also encourage people to adhere to the protocols and limit gatherings, events, parties, and all that. If we don't bring all these leaders to help us, it may be difficult for other people to understand. So I think at this time, government should begin to relook at some of the earlier measures we took and to bring all the stakeholders on board, being the chiefs, being the churches, religious leaders, the students. Almost all bodies must be involved, have focal leaders, and encourage them to speak to their own people so that they will be able to go along with that, so we don't reach a point where this will become a danger for us.
And at the individual level?
Yeah, at the individual level, we need to encourage people to be able to at least adhere to these protocols. We need to still educate people, help them out to be able to understand the need for them to protect themselves, to save their lives so that they don't put other people's life in danger or their own lives in danger.
Dr. Michael Owusu, I'm grateful for your time. He's a virologist and a researcher at the KCCR. He's also a lecturer at KNUST. So you heard him right. He says that people must be encouraged to actually protect themselves from contracting the virus. We hit the streets of Accra to find out from you, as you prepare to celebrate Christmas, how do you intend to protect yourself? Listen to what people have been saying.
I don't have any plans about the Christmas, understand? Because everywhere is tight. There is no money in the country. So I have nothing to say about the Christmas. Coronavirus issue. Before I attend to someone, I wash my hand properly. And before talking to, even though I'm going home, I used to wear face mask too. So
for this Christmas, there is no money, so I'll be in the house. Yes, I'll be in the house, and I think that will be safer. Yeah. than me going out to mingle out with people. Yeah. So, as they used to advertise for us to see, through the pandemic, we've been putting on the nose mask, washing our hands, using the sanitizer. Yeah.
Okay, this year no money, so preparations, we are just there. Where it's moving, we also try to move there. Okay, this Christmas, actually we are just going by the protocols. That's washing your hands, wearing the mask, and avoid social distance. Hey, yeah, so when you are going to gathering, you just have to be careful where you are. If it's not necessary, don't force yourself to be there.
For the Christmas, I am not really having any plans. Basically, I don't have any plans for Christmas. I'm just thankful for how far I've come. And then for protection, I am adhering to the COVID-19 protocols laid down for...
While Communications Officer of the National Democratic Congress, Sami Jemfi, has dragged the Ghana Health Service and the Ghana Airport Company Limited to court over the mandatory vaccination policy. The no vaccination, no entry policy was introduced at the airport last week to prevent unvaccinated travelers from entering Ghana. This, according to the authorities, is a measure of controlling the importation of COVID-19 cases, especially with the new Omicron strain. But Mr. Sami Jemfi, together with 3 other applicants, insist this is unconstitutional. They want the court to overturn the directive. We'll look at some of the reliefs they're seeking, and here you are. It says application for the enforcement of fundamental human rights, or the 6-7 of CI 47. Please take note that this honorable court shall be moved by counsel for and on behalf of the applicants hearing, praying this honorable court for an order of the court granting the following reliefs. And it starts with a declaration that the impugned directive of the respondents breach or threaten to breach the applicant's fundamental human rights as enshrined under Article 21(1)(g) of the 1992 Constitution of Ghana. And 2, a declaration that the directives of the respondents violated Section 2(1) of the Imposition of Restrictions Act 2020, Act 1012, and Sections 21, 22, and 30 of the Public Health Act 2012, Act 851, and therefore illegal. C, a declaration that the directives of the respondents contravene the guidelines of the Food and Drugs Authority, Ghana, on the administration of emergency use authorized medical products, and same are unreasonable. And D, a declaration that the directives of the respondents contravene the guidelines of the World Health Organization regarding proof of COVID-19 vaccination for international travelers, and that same is unreasonable. E, a declaration that the directives of the respondents contravene medical ethics and best practices that govern COVID-19 vaccine administration. And F, an order of certiorari to bring before this honorary court the directives of the respondents to be quashed as having been made without any constitutional or legal and or reasonable basis whatsoever. And F, an order of certiorari to bring before this honorable court the directives of the respondents to be quashed as having been made without any constitutional, legal, and or reasonable basis whatsoever. G, an order of prohibition and or injunction directed at the respondents, their agents, and or assigns, restraining them jointly or severally from taking any steps contained in the directives relating to the implementation of compulsory COVID-19 vaccination at Kotoka International Airport, constituting restrictions on the freedom of entry into Ghana of citizens and the freedom of leaving Ghana of all persons. And H, any further consequential orders that the Honorable Court may deem fit. This is the application for the enforcement of fundamental human rights, and it was filed by Sami Jemfi, who is the communications officer of the National Democratic Congress, and 3 others in court.
Everywhere in the world, the media is getting saturated with lots of hoax news stories, false claims, exaggerated headlines. Simply, fake news is spreading fast.
In this pandemic, fake news is a new infodemic. But fearless journalists at JoyNews are on the front line, fighting fake news with a series of fact-checked, compelling news reports. The JoyNews Combat Fake News Project, clearing the blurry lines between fake news and the news.
And as you see on your screens, it's being supported by the Media Foundation for West Africa and also with funding support from the European Union. Before we go, let's check out our COVID situation in the country. New cases now stand at 156, active cases at 1,301, confirmed cases at 1,332, 132,288, recoveries now at 129,728, deaths over 1,000 is at 1,255. And if you look in that map, you would see those big red circles. It's Greater Accra is still leading the chart and followed closely by the Ashanti region.